orthopedic surgeon and sports medicine physician, and today I'm reviewing skateboard injuries. As always, I gotta tell you, well, I'm not a skateboarder. I don't really know anything about skateboarding, I don't know any of the tricks, and I don't really recognize any of the skateboard people who are famous. I know Tony Hawk, but that's it. If you're new to the channel, be sure to subscribe and hit the notification bell. If you're a returning member of the Intern Army, you know what to do. Go smack the like button and share this bad boy with a friend. And if you have any medical questions that you would like to discuss, feel free to join us on our live stream, which occurs at 7 p.m. Eastern Standard Time every Sunday evening. That being said, let's get to the skateboard injuries. So let's see this first one. Okay, we have skateboarding down steps, and then we have landing on a outstretched hand. Whoosh mechanism. And you can instantaneously see what is going on. He has now sprouted a second elbow on the left-hand side. So he has a both bones forearm fracture of the left forearm. I don't see any wounds or any lacerations, so I would venture to guess that this is a closed injury. And these young men appear to all be in their early to mid-teens. So there is a possibility that he'll be able to have this treated with a closed reduction and cast mobilization only. He may not require an open reduction internal fixation. If he is, however, past his growing years, then he may require surgery for this, which would either be a open reduction and internal fixation with plates and screws, or it could also be internal fixation with flexible rods and then cast immobilization. All right, on to the next one. Jumping off of a bench, down some stairs in slow motion, we see here, yep. Okay, so as he lands on the pavement, we can see that he doesn't quite stick the landing and his left foot slips off of his skateboard and onto the ground. As he has a significant amount of force which is being directed towards the ground, we can see that his left ankle buckles, causing his left foot to be forced into inversion. In other words, being angled or tilted towards the inside. And he suffers a fracture of his left ankle. So obviously he's not able to weight bear on it after this, and this is probably something that will require surgery unless the displacement is minimal. All right, so we have a young man jumping down the stairs. He appears to be grinding his board on the railing. As he gets to the bottom of the stone railing, he falls off and he lands on his arm. And you can see that this young man has sprouted a second elbow, but this time above the level of his elbow. So we know that he has suffered a distal humerus fracture. And in this case, this is probably a supracondylar humerus fracture, as it appears to be relatively close to the level of the elbow. A supracondylar fracture is a type of fracture which occurs just above the level of the joint. It is something that is typically an extra-articular fracture, meaning that it occurs outside of the joint. Although in some cases there can be an intra-articular extension, meaning a fracture line that extends from the main fracture itself down through the joint. And that's going to require at least a closed reduction with potential pinning, maybe even an open reduction and internal fixation. So we have a young man jumping off of, I'm not sure what he's jumping off of there, jumping off something which is elevated down to the ground onto a very narrow strip of what appears to be concrete. When he does so, unfortunately, both his feet miss the board and they land onto the plywood or the landing surface that they had placed onto the ground. And we can see that his left leg lands at an oblique angle, meaning like this. And as he does so, the force of the impact causes his bone to break in the mid shaft, right there in the middle. And as I've said before, bones are great in compression. They suck in rotation. As I said in another video, bones are very strong in compression, but they are crap in rotation. But they also suck under tension. When the skateboarder lands with his leg at an angle like this, his bone is now under tension, causing it to bend. And at a particular point, the tibia exceeds its tensile strength and then it breaks.
I think it's gonna go like this. Right.
And in the aftermath, we can see that on the inside aspect of his leg, there is a bright red spot. So we know that this is not only a tibia fracture, but it is an open tibia fracture. We're not able to see exactly what the size of the laceration is on the inside part of his leg, but we know that because this is an open fracture, that the healing of this fracture and the potential complications from this fracture are now quite a bit higher than they would be if this had been a closed fracture of the tibia. And because this is an open fracture, we now know automatically this fracture is going to require operative management. And at the very least, an irrigation and debridement, in other words, a washing of the fracture site, particularly where there is opening through the skin. It will also require internal fixation by either an intramedullary nail or plate fixation of the tibia and or the fibula. Consequently, we can expect the recovery from this injury to take quite a bit longer than it would have taken if the injury had been a closed injury only. So we have a guy grinding his skateboard on a ledge. Oh, he has a fall there, no problem. He's gonna do it again. Okay, and so this is a really good slow motion video. So we can see that as his right foot slips off of the skateboard and gets planted on the ground, the board continues to move, taking his momentum away from the planted foot. And now he starts to have a force that is applied on the tibia, and in this particular case, at the mid shaft of the tibia. Afterwards, we're able to see the x-rays of the skateboarder as he sits on a bed with his leg casted. We can see now that this was more of straight tension mechanism because we have basically a transverse fracture of the tibia and a transverse comminuted fracture of the fibula, both at the mid shafts. Fortunately, this is a closed injury, and so he doesn't have the added complications that are associated with that injury. He does have, however, what we call a very large body habitus, and it's important to note that obesity is associated with higher levels of complications after fractures and other types of injuries like this. Okay, on to the next one. So we have a young man trying to grind a rail here. The board gets caught up and he falls to the other side onto his outstretched hand. And once again, we have the extra elbow sign in the middle of the forearm. And so we know that he has suffered a both bones forearm fracture of the left forearm. Once again, this appears to be a closed injury. There does not appear to be any significant laceration or any evidence of blood on the forearm. So generally, this is something that can be treated either with a closed reduction and cast immobilization for a period of approximately 6 to 8 weeks, or it may require an open reduction and an internal fixation if the physician is unable to obtain an anatomic reduction in the emergency room or in the OR setting. So we have another young man attempting to grind a rail, and if you know what kind of grind this is, you can tell me, but I don't really know. But he attempts to grind a rail, and he falls off, and he lands face first with his hand in an outstretched position. And you can see that immediately as he hits the ground, he has a marked deformity of his forearm, of his right arm. And this is obviously going to require some type of medical management and most likely operative fixation of his wrist. And for this last one, we have a young man attempting to grind a rail in the dark. He only gets partway down the rail before the board becomes stuck, and he ends up, because of his momentum, flying face forward down probably 2 flights of steps, landing onto his face. Once he's on the ground, he has a decreased level of consciousness. And he is not completely comatose, but he has a very low GCS, or Glasgow Coma Scale. And the lowest score that you can get on the Glasgow Coma Scale is a 3 out of 15. And he's not quite there, but he's pretty close. This young man needs some immediate medical attention, at the very least to help him protect his airway. He's probably going to end up with some kind of concussion if he doesn't also have facial fractures after this injury. So there you have it. Today I've been reviewing skateboard injuries. And as you know, I'm all about education. So what are some takeaways from this video? Number 1, ankle injuries are common with skateboarding. So If you're a skateboarder, make sure that you take time to work on the flexibility and the strength of the muscles of your lower extremity, and in particular, the muscles around your ankles, to make sure that you minimize your chance of injury when you do this activity. Number 2, skateboarders spend a lot of time jumping over things and landing. So please make sure that you take time to train proper landing mechanics to make sure that when you land from your jumps, that you do not do so with your legs in a compromised position. Therefore, you can minimize your chance of injury from landing with these types of mechanisms. And number 3, wrist injuries are quite common. So if you're a skateboarder, make sure that you take time to include wrist prep exercises to ensure that your wrists are very strong so that when you fall, you don't break them.
He needs some milk.
And as always, that's been a word from Dr. Chris, not your everyday ortho.